Hi, Nurse Sherry here, and today we're going to be going over how to set up a room for a sore throat or any throat complaints or mouth sores, and how to do a throat culture for sensitivity. All right, so what you need to set up for a throat complaint is going to be a culture. When you grab these, make sure you check the expiration date. It's always going to be on here somewhere. You can see it here. It says expires 5/31 of 22. Obviously, all of my stuff is probably expired because I just use it for my videos, but you always want to check. Everything has an expiration date on it. Then we have a tongue blade. I have a pen light, an otoscope with the earpiece attached, a pair of gloves, and a mask. All right, so I'm going to go ahead and apply my mask. And I always pinch here to make sure that you got it secure on here. And then I'm going to go ahead and apply my gloves. So it's very important when you're looking at somebody's throat is to make sure that you can see their tonsils and all around their mouth, so that you're able to get a culture if you need one, or to see what kind of sores you have. Now, this could be, I could need just a regular culture, which this would cover. Maybe they have like a herpes sore or something in their mouth, and I'm going to swab that. Usually you can determine those by the look though. So if somebody comes in with a sore throat complaint, the doctor usually wants to check the ears as well. So I have the otoscope for that. The pen light, I'm going to go ahead and turn on, and I'm going to take the tongue blade and I'm going to place it on the patient's tongue here. And then I'm looking back. If you can see, you see the uvula in there? Here, the thing that hangs down there, that's your uvula, that's your gag reflex. Over here would be the tonsils, okay? So first I'm looking at the tonsils. So the tonsil is right here, okay? And you'll see when I swab it. Obviously you wouldn't touch that with the tongue blade, unless you were popping out a tonsil stone. Okay, so I'm gonna place my tongue blade on their tongue. You're gonna ask them to say ah, because that brings the uvula down and it opens up the throat so that you can see very clear. So I'm going to look in here and we're going to say I see some puscular over here and over here. So now I'm going to go ahead and open up my culture, and you'll do that by just opening like this. You'll have a lid you'll need to just pop off, swab, and then you have the culturette. I'm going to take the swab and Q-tip portion out, and I'm going to make sure that I do not touch it, because this is what is going to be tested to see what bacteria is in the throat. Okay, so it's going to be on here, so I don't want my germs on there. It's sterile inside here. I do not need sterile gloves to perform this test. I do wear I wear a mask in case the patient coughs or sneezes while I am performing this skill. Okay. So here is my culture tube. I'm going to go ahead and lay that back down in the paper that I had it in. I'm going to take my pen light and I'm going to place the tongue blade down, okay? And then I'm going to take my swab and I'm going to swab the tonsils, okay? This is where I see it. I want this to go on the tonsil. People gag, okay? So you have to really be careful to make sure that you get just the tonsil area and avoid the uvula, okay? So after I get it, and we're wanting to make sure that we touch any of the pus that you might see, okay? Then I'm going to place this back down. I'm going to turn this off. I'm going to take my culture. I'm going to put it in here. And then on my label, I'm going to write my patient name, the date that I collected it, my initials, where the specimen came from, so mouth, the patient's date of birth, what organization you're with, so if you're with the lab or the doctor's office, however you want to put that, what unit, or, you know, depending on if you're working in a hospital or a doctor's office, and then your initials and the time is what you're going to put on this. Then you will place it in a biohazard bag, and you will print off the order. So you place this portion in the biohazard bag like this, and then you'll print the order or the requisition out, and you'll place that in here. And so that makes sure that nothing gets contaminated in here. And then you'll take this to the lab for processing. To remove gloves properly, you're going to pinch the palm of your hand and you're going to pull the first glove. The second glove, you're going to stick your fingers underneath and then take them out like that. All my dirty is inside there, so I'm going to throw those away. Wash my hands